Hello and welcome to this week's episode of the Africa Within podcast. I'm your host, Nontobeko Mlambo. Today we are diving into the incredible story of polio eradication in Nigeria, a journey of resilience, innovation and community efforts. Nigeria, which was once a global hotspot for wild poliovirus, officially eradicated the disease in August of 2020. This monumental achievement marked Africa's certification as free of wild poliovirus. But this success didn't come without challenges. In fact, the road to polio eradication was long, filled with setbacks and remarkable recoveries. So what made this possible, and where does Nigeria stand now in its fight against the poliovirus? To understand the present, we must first look back. Nigeria, the most populous country in Africa, was once the epicenter of wild poliovirus transmission. In 2012 alone, Nigeria accounted for more than half of all polio cases worldwide. The reasons for this are a combination of many factors, which include higher population density, poor sanitation, and limited access to health care, which created the perfect storm for the poliovirus to thrive. To discuss the topic, we are joined by Aishat Hashim, a registered nurse, midwife, and a public health specialist from the northern part of Nigeria, Sokoto State. Hashim holds a degree in nursing sciences, and she specializes in community health, prioritizing vulnerable populations. She's also participated as a team member of vaccination programs, including measles and polio.
I am Aishat Hashim, a seasoned public health professional with a background from community health nursing and midwifery. I have extensive experience in clinical area and in the field on immunization for polio campaign. The experience are based on designing, implementing, and evaluating health programs, most particularly in the areas of immunization, as I have said, with over 5 years experience in the field of immunization, and then over 15 years experience in the clinical area. I have the privilege of working on various immunization campaigns, which polio eradication is inclusive. I have the privilege of working on various immunization campaigns, which polio eradication is inclusive, and also an advocate and technical advisor. I have worked with governments, international organizations, and local communities to develop and implement effective immunization strategies. I am passionate about contributing my expertise to the global effort to eradicate polio and ensure that every child has access to life-saving vaccines.
What is polio, and can you describe the current state of polio eradication efforts in Sokoto?
Okay. Polio, also known as poliomyelitis, it is a highly infectious disease caused by the poliovirus, which can lead to paralysis, disability, and respiratory failure, and even death. In Nigeria, the current state of polio eradication is a mixed bag. While the country has made significant progress in reducing polio cases, there are still challenges to overcome, particularly in the northern region, including Sokoto State.
What role do vaccination campaigns play in preventing polio?
In Sokoto, polio eradication efforts are ongoing with focus on vaccination campaigns and community engagement. However, the state still reports cases of circulating the vaccine-derived polio virus type 2, which we all know is a concern. The World Health Organization and other partners are working closely with the government to strengthen vaccination efforts and improve surveillance.
Sokoto State, where you work, faces insecurities, which poses a significant barrier to polio eradication efforts. We know that armed banditry, violence, and displacement of communities make it challenging to reach children with life-saving vaccines. Health workers like yourself often face dangers traveling to conflict zones, and misinformation spreads quickly in areas where trust in health campaigns is already fragile. How then has polio impacted individuals and communities in hard-to-reach and conflict-affected areas?
Polio has had a devastating impact on individuals and communities in hard-to-reach and conflict-affected areas because you see, many children have been paralyzed or disabled, and family has already been torn apart by this polio disease. The economic burden of polio is also significant because many families are struggling to access health care and rehabilitative services.
What role do vaccination campaigns play in preventing polio?
Vaccination campaigns play a crucial role in preventing polio. Most especially the OPV, oral polio vaccine, which is the most common used vaccine in Nigeria, and it has been effective in reducing polio cases. However, in areas with low coverage vaccination, the risk of vaccine-derived poliovirus is becoming higher. The cases are emerging too much in areas with low vaccine coverage.
What have you found to be the biggest challenges in delivering polio vaccines to remote or conflict-ridden regions in Nigeria?
The biggest challenges in delivering polio vaccines to remote areas or conflict-ridden regions in Nigeria include insecurity, poor infrastructure, and misinformation. In some areas, there are reported instances that health workers face significant risk in delivering the vaccines, and there are instances that health workers face violence during the process of delivering these vaccines, or even the process of administration, administering the vaccine itself.
How do ongoing conflict and insecurity in this region impact vaccination campaigns?
The ongoing insecurity and conflicts in the region have severely impacted vaccination campaigns because the displacement of people and the destruction of infrastructure have made it difficult to reach vulnerable populations with the vaccines.
How does misinformation and vaccine hesitancy affect eradication efforts?
Misinformation and vaccine hesitancy are also significant challenges in these areas. Some communities are skeptical about the safety and efficacy of the vaccines, which make them to be hesitant about receiving the vaccine, and this has led to low vaccination coverage. Though health workers and community leaders are working to address this concern to promote vaccine acceptance.
How do health workers like yourself navigate security risks in conflict zones to deliver vaccines?
Health workers navigate security risk in conflict zones by working closely with the local authorities and community leaders. They also use some innovative strategies like the outreach services and mobile vaccination teams to reach these vulnerable populations to ensure coverage.
In our communities, we know that community leaders and religious leaders are mostly respected and listened to. What role do these community leaders and local governments play in the fight against polio?
Community leaders and local governments play a critical role in the fight against polio. because they help to promote vaccine acceptance, remove misconception or any hesitancy on the safety and effectiveness of the vaccine. Then they mobilize communities for vaccination campaigns and ensure community involvement and provide support to health workers.
From your experience, what's the most significant factor contributing to progress or setbacks in eradicating polio in these areas?
Well, from my experience, I can say that the most significant factor contributing to progress or setback in eradicating polio in these areas is community engagement. Community involvement, and then this issue of insecurity. When communities are informed and involved in vaccination efforts and the environment is safe, the community are more likely to accept vaccine and support health workers.
How do international organizations like the World Health Organization and UNICEF collaborate with Nigeria on polio eradication?
International organizations like the WHO and that is the World Health Organization and the UNICEF collaborate with Nigeria on polio eradication by providing technical and financial support. They work closely with the government of Nigeria to strengthen vaccination efforts. They also improve surveillance and promote community engagement.
What message would you like to share with stakeholders and the global community about the impact of eradicating polio in Nigeria?
My message to stakeholders and the community is that eradicating polio in Nigeria requires a sustained and collective effort. We must continue to support vaccination efforts, promote community engagement and involvement, throughout the campaign, address the root cause of insecurity and misinformation, because together we can create a polio-free Nigeria and a safer and healthy world for all.
Thank you very much, Aishat, for joining us for such an important conversation on polio.
Thank you very much.
That's it for today's episode of the Africa Written podcast. Thank you for joining us on this deep dive into Nigeria's fight against polio. Remember that the fight against infectious diseases is a shared responsibility. Let's stay informed and let's keep the world polio-free. Until next time, stay healthy and stay hopeful. Thank you for listening.